We'll stand for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Morning, everybody.
Good morning.
Good morning, Mr. Chair.
Can I get approval of the county board minutes? Got a motion by
Second.
Commissioner Blaine, seconded by Commissioner Lemire. All in favor signify by saying aye.
Aye.
Opposed, motion carries. Are there any additions or deletions to the agenda? If none, can I get a motion to accept the agenda?
So moved.
Okay, we got a motion by Commissioner Blaine, seconded by Commissioner Jelinski. Any further discussion? If none, all in favor signify by saying aye.
Aye.
Opposed, motion carries. National Crime Victim Rights Week proclamation. Welcome.
Hello.
Good morning.
I want to come over.
Morning.
Stephanie Ock from Hands of Hope Resource Center. Let my staff introduce themselves.
Johanna Klinkner with Hands of Hope.
Good morning.
Good morning, Joanna.
Morning. Lindsay DiMatteo from Hands of Hope.
Good morning.
If you want, you can, to communicate better, you can move this mask too.
Can hear you better.
Now we can see you.
Okay, so National Crime Victim Rights Week is April 18th through 24th, 2021. Whereas being a victim of crime and navigating the criminal justice system can be a frightening and confusing experience. Whereas progress in improving the treatment of crime victims has been made through the efforts of thousands of victims and survivors who have turned their own experiences into a force for positive change, ensuring that others can receive justice, meaningful assistance, and compassionate treatment before the law. Whereas since the passage of the Victims of Crime Act of 1984, and through the dedicated work of advocates, lawmakers, and victim service providers, there is a growing array of services and resources available to victims and their loved ones. Whereas honoring the rights of victims, including the rights to be heard and to be treated with fairness, dignity, and respect, and working to meet their needs rebuilds their trust in the criminal justice and social service systems. Whereas individuals' trust in the compassion, understanding, and support of their communities is achieved through sustained, deep-rooted, and coordinated outreach. Whereas identifying, reaching, and serving all victims of crime, especially those from groups that often have less access to healing services and avenues to justice, is essential. Whereas our community's continued engagement with the challenges faced by victims of crime will ensure that the progress made to date is not lost, and that new ground is broken to gain greater justice and healing for all victims. Whereas National Crime Victim Rights Week provides an opportunity to recommit to ensuring that accessible, appropriate, and trauma-informed services are offered to all victims of crime. And whereas Hands of Hope Resource Center is hereby dedicated to supporting victims and survivors in the aftermath of crime, building trust among our clients, collaborating with other service providers, and engaging our community in response efforts. Now, therefore, we, as Morrison County Commissioners, do hereby proclaim the week of April 18th through 24th, 2021 as Crime Victim Rights Week, reaffirming this Morrison County Commissioners' commitment to creating a victim service and criminal justice response that assists all victims of crime during Crime Victim Rights Week and throughout the year, and expressing our sincere gratitude and appreciation for those community members, victim service providers, and criminal justice professionals who are committed to improving our response to all victims of crime so that they may find relevant assistance, support, justice, and peace.
Thank you. Could I get a motion? Got a motion by Commissioner
Second.
Wincher, seconded by Commissioner Lemire. Any further discussion? Commissioner Wincher?
Thank you, Mr. Chair. Again, this is something, I believe every year we come out with this here, and it's not like, things happen in this county. It's even though we're not down in the suburban areas and the urban areas, this is something that people should be made aware of, and that's what you guys do, because little crimes, large crimes, maybe we don't have the murders and all that like some of these other counties and cities have, but even though the rest of it always affects us. So again, I appreciate you coming for the board.
Thank you very much. Anybody else got anything? Not all in favor signify by saying aye.
Aye.
Opposed? Motion carries. Thank you very much.
Thank you. We were fortunate enough to get a federal grant to really promote National Crime Victim Rights Week this year. So that's why the T-shirts, and we have a couple of billboards up you might have seen in the community, and radio ads and different things like that. So we're just really trying to promote the work that we do so that people know we're here.
And thank you
Good.
for the.
Thank you very much.
Thank you very much.
Mr. Chair, if we could take a photo, maybe if you ladies want to stand in front, and I think we all have T-shirts, maybe if we hold those up and just kind of show support in that regard, do you think that would be a nice? Yes.
See how they're gonna do this.
Maybe if we all kind of stand there like this, and I'll join in, since it's more about just promotion of this whole concept. How's that? You
Look at that.
be right in front, and they'll be able to see us over there. Perfect.
Fantastic. Thank you very much. Thank you.
Thank you.
Gotta mix it up a little.
That's good. Okay, next we'll have Vulnerable Adult Abuse Awareness Proclamation. Brad,
Good morning,
welcome.
Mr. Chair, Commissioners. I'm going to have Lynn Gross come up and read it, and I know it's not May yet, but we have a lot of proclamations in April and May. So this is actually for May, but Lynn is going to go ahead and read it, so.
Welcome, Lynn.
Thank you.
Morning, Lynn.
Morning.
Morning.
Morning, Sarah.
Good morning.
Vulnerable Adult Abuse Awareness and Prevention Proclamation, Morrison County, Minnesota. Whereas people who are elderly or have disabilities have contributed to the general welfare of Morrison County by helping to preserve customs, convictions, and traditions of many people from diverse backgrounds. And whereas these residents are vital and integral members of our society and their wisdom and experience have enriched our lives. And whereas abuse of the elderly and people with disabilities in domestic and institutional settings is a widespread problem affecting hundreds of thousands of people across the country. And whereas suspected abuse was reported 226 times on Morrison County citizens who are elderly or have disabilities in 2020. And whereas abuse is grossly underreported because of the vulnerable adult population who are being abused find it very difficult to tell anyone and are usually ashamed and sometimes afraid. And whereas abuse happens to men and women of all income levels, all cultural and ethnic groups, whether they are in good health or incapacitated in some way, and in neighborhoods and in rural areas. And whereas many of the cases investigated by Adult Protective Services in Morrison County involve self-neglect and financial exploitation, it is our duty as citizens to reach out to these people in need. Now therefore, we the Commissioners of Morrison County do hereby proclaim the month of May 2021 to be Vulnerable Adult Abuse Awareness and Prevention Month in Morrison County, and urge all citizens to work together to help reduce abuse and neglect of adults who are elderly or have disabilities.
Can I get a motion on that?
So moved, Mr. Chair.
Okay, we got a
Second.
motion. Okay, we got a motion by Commissioner Jelinski, seconded by Commissioner Wincher. Any further discussion?
Mr. Chair, if I may.
Yes.
Vulnerable adults can be anyone. That's an adult, obviously. But it doesn't mean that you come from this side of the street or that side of the street, from that housing project to that big house on a hill. Anybody can be a vulnerable adult. And for what you do is second to none, because no one wants to admit that they're a vulnerable adult. That sometimes can be the hardest thing, in my estimation anyway, is simply the admitting, if you will, yeah, I am a vulnerable adult. Or if that person can't admit that, to have someone such as yourselves to be able to take that lead to say, yeah, you need a little extra hand here. And I got to tell you that is so important, and perhaps in the world that we're living in today, maybe it's more important. But it's so important, and I can only thank you for what you do.
Thank you.
Thank you.
Thank you. Has anybody else got anything? Not, we got a motion and a second. All in favor, signify by saying aye.
Aye.
Opposed, motion carries. Thank you very much for what you do.
Thank you.
Hey, ladies.
Stay safe.
Yes, we can take a picture if you want to come, maybe do the standard. Oh, Sarah, I wouldn't forget.
Excuse me?
Thank you.
What?
Thank you.
Thank you very much.
Thank you, ladies.
Thank you.
You're welcome, Sarah.
Let's see.
Next, we'll have Land Services. Amy? Welcome.
Good morning, Miss Amy.
Morning.
Okay, I have a couple of items for you following our planning commission meeting last week. And I'm
Lakin, I just turned it back on.
Lakin.
It's the one in the telecommunications tower.
Okay,
in
thank you. All right, so the first one is to construct a 190-foot telecommunications tower. This was recommended for approval by the planning commission at their meeting. So that is the first one I've got for you today.
I'll make a motion for more discussion.
Okay, we got a motion by Commissioner Winter, seconded by
Second.
Commissioner Jelinski. More discussion? Randy?
Thank you, Mr. Chair. I was on the call too with
Yes.
the planning commission. There was there was a long, shutdown as far as the system goes. Again, I'm sure that would be disappointing. It was disappointing for me because it was about a half an hour. And so I'm assuming those are things that we'll correct as we go.
Yeah,
you know, so-
actually, that was a very interesting issue. What we discovered was someone else on the meeting was trying to share their screen, and what it was doing was hijacking my ability to share the screen. And so we had to turn the permissions off within the meeting in order to take away the everyone's right to share their screen. So we were battling. We had a user who had never been on Teams before and was just hitting buttons, and every time she'd hit that, it would take the screen presenting ability away from me, and we didn't know what was going on. So yes, lesson learned. We have figured that out.
And then a little bit more thing on, I think the planning commission did a great job of vetting this here. I mean, they had some good people that were opposed to this, and they got through those questions and answers. And from what I heard, again, they asked good questions. I think moving forward, hopefully this will continue. So again, just my input on that is that I hope it'll work out just by having the 5 board members.
Yeah, I thought they did a wonderful job with their first meeting, balancing both the Board of Adjustment and Planning Commission. So, yes, and if you have any suggestions for them moving along and feedback, then certainly share that with me so we can be sharing that with our new board.
Thank you. Has anybody got anything else? If not, we got a motion on the floor. All in favor signify by saying aye.
Aye.
Opposed, motion carries.
All right, thank you. And the next item I have is an interim use permit request. This was also recommended for approval by the Planning Commission. And this one is to establish a home extended business, specifically for a custom exempt meat processing facility. That was recommended with some conditions. And those conditions are, prior to state licensing, the property owner shall have the existing septic system servicing the meat processing facility evaluated by a licensed septic system designer, and shall make all required changes to the septic system to meet state and local septic laws and requirements. And this work shall be done with permits and inspection by the Land Services Department. The second condition would be the property owner shall provide the Morrison County Land Services Department a copy of the licensing from the Minnesota Department of Ag. Third, abide by all applicable state and local laws regarding meat processing facilities. 4, waste from the meat processing operation shall be stored in covered leak-proof containers and shall be disposed of at the Morrison County Solid Waste Management Facility by a licensed solid waste hauler or self-hauled on at least a weekly basis, or the services of a rendering company shall be utilized. 5th would be the interim use permit shall terminate 7 years from the date of permit issuance. And 6th, the property owner shall keep records and/or receipts of hide disposal, septic system pumping, and maintenance, rendering and landfill disposal, and these records shall be made available to the Land Services Department upon request.
Thank you. Can I get a motion on that?
So moved, Mr. Chair.
Got a motion by Commissioner Blaine, seconded by
Second.
Commissioner Lemire. Any further discussion? If none, all in favor signify by saying aye.
Aye.
Opposed, motion carries.
All right, thank you, that's all I have.
Thank you, Amy.
Mr. Chair, our next presenter is joining online.
Oh,
He's on.
okay.
I'm going to,
Next, we have the Initiative Foundation. They're joining online.
Carl, I believe you're on. We see you now.
Great, can you hear me?
Yes, we can.
Oh, excellent. Well, thank you for giving us a few minutes for an update this morning. And sorry for coming in remotely. We're still encouraging all of our staff to work remotely for now, but hoping to get back to in-person meetings real soon. I think everyone has the update document that I sent in. And I can just walk us through that really quickly, and then I'll provide some other highlights, and I'd be more than happy to take any questions if anybody has any questions for us.
Sounds good. I'll share my screen, Carl, so you can see what we have here. And that's the document you submitted.
Great, thank you. I should say I'm getting a weird feedback of my own voice on my computer. So if I get a little confused from moment to moment, it's because I'm hearing myself bounce back to me. So, but I think I can work through it. So, this is the 2019 impact sheet for Morrison County. I wanted to get the 2020 version, but wasn't able to get them through design and everything for this meeting. So I think this one you've all already seen. But again, just kind of a quick snapshot of the amounts of funds that we've been able to funnel into Morrison County, our investment, the county's investment back into us, and then of course kind of ROI, return on investment number there for every dollar raised, the amount we're able to invest back into the county. And then just below that economic impact number is that, as it says, since 1986 to present through the end of 2019 there, you can see all the grants, scholarship loans, jobs created, retained, and the component or partner funds that we use that serve Morrison County. So I think everybody's pretty familiar with those numbers. So no, I don't think we have any reason to go into any more depth on those. And then the next page just highlights some recent grants, business financing. Again, those charitable component funds that we're hosting that are serving Morrison County. And then down at the bottom, some of the nonprofits, of course, that have gone through our nonprofit training or coaching or leadership sessions, et cetera. And then just a few community action highlights there at the bottom of just kind of some stories to tell of the impact. So if no one has any questions on those particular documents, I think the rest of the document kind of goes into 2020 specifically. And I can go into that if nobody has any questions about what I've shown so far.
Does anybody have any questions? Proceed.
Great, thank you.
Thank you.
So this was a pretty amazing year for us at the foundation. On top of all the work that we usually do, we were tapped with a lot of COVID relief and recovery, as I'm sure everyone was working in that area. At the top, we could talk about the small business loans. We did 10 loans in Morrison County, totaling $1.6 million. 8 of those loans were actually deed emergency loans, and 2 of those loans were from our typical gap lending this year. Normally, we would do a lot more gap loans, but because deed had tapped us to do some of those COVID emergency relief business loans, we kind of shifted our work over to that direction. Those loans, as you can see, totaled $454,000 and $2.8 million in leverage, and created 24 jobs and retained 120 existing jobs. We were happy to do that. On top of that, Deed also tapped us with doing what they called emergency business grants, a project that we nicknamed Gigrantosaurus. This was, I think, ended up being 776 $10,000 grants across the region that we processed. At one time, I think we had 24 of our 26 staff working on this project alone to process and push through, evaluate, and get all these emergency grants. to businesses. So this was quite a project. And then if you just scroll up a little farther, you can kind of see a map there that will just kind of charts out the gap loans, emergency loans, and then of course these business relief grants all out over the region. Some of these did get a little outside of our typical service region, but of course this was indeed, I'm sure you're familiar, kind of had a lottery system for these grants and however, an awards were chosen and stuff, but just kind of a neat kind of quick glance summary at how the lending and grants were distributed. Does anybody have any questions about the business finance side?
None here.
And we continue, we expect to get back to more typical gap lending this year, but we do anticipate more COVID emergency relief to come through as well. And we're just going to jump on those projects as needed and continue to support our small business community. In terms of grants, again, lots of grants, lots of COVID relief grants. Again, one of the big barriers that we continue to hear from local cities is that access to affordable quality childcare is a barrier to workforce attraction and retention. And so we've been working in that area even before the COVID-19 pandemic. As part of that pandemic, there was a lot of emergency support for childcare providers, and we were able to capture some of that support and funnel it into the region. 111 emergency childcare grants. We were able to grab some support as well from the governor's education emergency fund, again, to get even more support in the region for our childcare providers. I think we made a grant in Morrison County. One to highlight was a $15,000 grant. I think it's called the Morrison County Association of Childcare Providers for summer programming for them. I think we've made a little over $50,000 in grants in Morrison County to support childcare providers. Most of that you wanted to call really just provider retention. A lot of it was just grants just to help them keep their doors open as they're kind of weathering the effects of the pandemic. And so if you scroll up a little farther, then you can see, of course, this is the spread of the grants. This would include all of the COVID grants, all of our grants from partner funds, emergency relief grants, et cetera. And you've got 97 of those coming into Morrison County. But there again, this is kind of the spread across the regions. Any questions about grants or support for child care providers?
Anybody got any questions? None here, thank you.
Yeah, we really do continue to see that as a major barrier to economic development and, of course, workforce retention and attraction, and is going to continue to be a priority for us. And although we don't have a magic ball, we do foresee more funding coming from the state legislature for that this year as well, and even some other neat projects that are in the works. And so we're anticipating that effort to continue to move forward. Real quick at the end, last few highlights just to point out, continuing to serve nonprofits in the region. We have a great nonprofit programming. They've renamed it Nonprofit Academy, but in a nutshell, just helping our nonprofits and their leaders increase their capacity, helping them develop good management systems, fundraising systems, et cetera. It's a great program. It's done a lot of good work for our nonprofits. I think we had 11 organizations located in Morrison County receive training and technical assistance in 2020. Just another highlight, not necessarily related directly to Morrison County, but again, we have a partnership with the Center for Disaster Philanthropy, working to support some communities that really have a lot of their workforce in meat packing facilities. They were really hit hard by the COVID pandemic. And so we put together some projects to serve those communities. We've got our entrepreneur team continues to work with the Initiator Fellows program across the region, really trying to develop key leaders and network them and train them and retain them in the region. And again, down at the very bottom, we have the Enterprise Academy program that continues to train entrepreneurs. It's been emphasizes low income and minority entrepreneurs, has been real successful in St. Cloud, now has expanded to Brainerd, and also will be having training cohorts on the Mille Lacs Native Nation in 2020. So lots of good work for the foundation. I try to condense it down in a nutshell and a few highlights, but we greatly appreciate your support of us and your contributions to our work, and really look forward to what we're going to be able to accomplish this year as well. And I know that's a super condensed version, but I'd be happy to take any questions anybody might have.
Does anybody have any questions? It looks like we have none here, but we thank you very much for everything you do for the community.
Thank you. Yes, we're happy to continue to serve our cities and our counties, and excited for what we're going to be able to accomplish this year. So again, we appreciate your support. Thanks so much.
Thanks, Craig.
Thank you very much. Okay, next, the Little Falls Airport. Welcome, Greg.
Good morning, how are you?
Morning, Greg.
Well, thanks for having me this morning. I just wanted to give you kind of an update on Little Falls Airport. We are currently constructing the crosswind runway. That should be done probably in about 3 months. So that's coming along nicely. If you recall, we did get a nice grant from the FAA in regards to that. And so this morning, we also have another grant in front of you. If you recall, what some of these last past stimuluses, the FAA was able to get some funds, and though they in turn distributed those funds to local airports. Our portion of it is $13,000 in grants that we can use towards O&M. It's a 100% grant, so there's no matching fund with it. So this morning, we are asking the county to approve the grant with the FAA in the amount of $13,000.
Can I get a motion on that?
So moved, Mr. Chair.
Motion by Commissioner Lemire, seconded by Commissioner Wincher. Any further discussion? None, all in favor signify by saying aye.
Aye.
Opposed, motion carries. Thanks, Greg.
Thank you, everyone.
Pretty painless.
Mr. Chair, do you know, Greg, did you get that changed from
did, yes.
Mike Lemire to Mike Wilson? So there is gonna be an email that comes through that you'll have to log into and sign, if you haven't seen it already, and then I'll sign it after today's action. I was waiting for two.
All good, thank you.
Thanks, Greg.
Thanks, Greg. Sheriff's report.
Actually, it's the attorney, Mr. Chair.
Oh, I'm sorry, I crossed the attorney off already.
Not because
I'm
he's
sorry,
not super
Sean.
important, yeah.
Do you see how long that was, that grant?
I'm one notch ahead. Sorry, Brian.
All right.
13 grand.
Good morning, board members.
Morning, Brian.
Once every 5 years, we need to re-sign an agreement with the Bureau of Criminal Apprehension to have access to some of their criminal justice network systems. And it's that time of year again. It's that year again. So in front of you are 3 documents that need signing. One is a resolution approving the joint powers agreement with the BCA and making the sheriff and I designated representatives under that joint powers agreement on behalf of the county. The next document is the joint powers agreement itself. It allows the county access to criminal justice data through the BCA. And then the third document is a court subscriber agreement. It allows us access to court records through the BCA systems. So again, every 5 years we have to sign this, and I'd ask the board to approve these agreements.
Thank you.
Chair, I'll move on this.
Got a
Second.
motion by Commissioner Jelinski, seconded by Commissioner Lemire. Any further discussion? Not all in favor signify by saying aye.
Aye.
Opposed? Motion carries.
Thank you so much.
Thank you, Brian.
Thanks, Brian.
Thanks, Brian.
Now Sheriff's report. Welcome, Sheriff.
Morning, Sheriff.
Morning, Mr. Chair, members of the board.
Morning, Sheriff.
How's everybody doing today?
Good.
Good. Sorry, just gotta check one thing. Okay. So we'll start off with the monthly report, and this is gonna be for March. we'll start with our pictures that we normally put up. This was a residence near Piers, and what they're gonna do is the homeowner was gonna have a controlled burn at the residence. And they were so kind to let us know that they were gonna burn the residence, and they wanted to know if our team wanted to do some training in it prior to the burn. So you'll see our SWAT team present, and we just took some photos, and just going in an unknown environment and to be able to train like that is definitely a positive for our team and for our guys. So that's what this photo is about. The next photo, if you remember, we got some mobile field force equipment, and part of that equipment was a gas mask. And of course, we wanted to make sure that we didn't have any leaks. Guys were trained properly, they were comfortable with their equipment. So we collaborated with St. Gabriel's Hospital. They sent a nurse out, and basically we did a leak test, and it was a success. No one ran out of the building, put it that way. So. Looking at our training, we had some officers attend less lethal ICP instructor training. I'm probably gonna get asked what that means, so, let's see, ICP, probably be impact, chemical, munition, pyrotechnic. So it's basically all SWAT stuff that we're doing there. Again, we had officers attend gas mask fit training testing, which is one of the photos. We had 25 officers attend cold water ice rescue training. That worked out pretty good. We started out at Piers Fish Lake the first day of training, and it was actually, the ice was actually out, so we kind of timed it a little bit wrong, but there was some still ice. There was some ice out on Lake Ellick, so we transitioned the following day to Lake Ellick, and we're able to use open water and ice, which was good for our staff to go through, because a lot of these guys and gals haven't been through that training yet, the ice water rescue training. So basically, we would use a dummy, the dummy would be floating, and we'd have to do some rescue missions, and then you'd go and try and maneuver from open water onto the ice, which it sounds easy, but really there's tactics involved, so just going through those motions and learning how to do that properly. And then we had 2 officers attend MRAP operators course, and 12 officers attend SWAT training. So if we move on to our criminal complaints, I'll just kind of highlight what we're seeing the most of. In that 5 o'clock position, you'll see like the orange triangle at 11%. We had 11 calls for disturbing the peace. The 7 o'clock position, which is the purple triangle on the bottom, we had 11 damage to property complaints. And then the 9 o'clock position, which is the red triangle at 16%, we had 16 thefts. The thefts included 5 from a building/yard. 3 were from a vehicle, not the vehicle itself, but 3 thefts from a vehicle. 2 gas drive-offs, 3 identity thefts, 1 shoplifting, and 2 false representation. You'll notice our traffic citations. Again, we're holding our numbers. We're doing fairly well. We had 250 traffic citations, ICRs. On my way through, one of our newer deputies, Brady Poonsack, was in the office. He's here with us today. I said, "You ever been to a board meeting?" He's like, "No." I said, "You should come check it out." So I'm pointing that out because he's one of our highest deputies for making stops. He does a great job. He does a lot of contact with the community, and he's in all areas of the county. So a lot of these numbers are obviously contributed by deputies like him going above and beyond. So 250 traffic citations. Out of that number, 165 were verbal warnings, 33 were written warnings, and there were 19 speed citations. So I took that in comparison of 2020, the same time frame, which would have been March. We had 87 traffic citations. So guys are doing good. And then last month, we had 211 traffic citations, so the numbers are holding steady. The 2-year comparison, You'll notice that we took a kind of a hike in the non-criminal and total criminal complaints, or total complaints, I'm sorry. March 21, we had 1,127. In March of 2020, for total complaints, we had 746. Again, that has to do with more of the traffic stops occurring, as well as our permits to carry and our permits to purchase that occur at our office. If you move on to the jail portion, you'll see Morrison County, we average 26 inmates. Itasca, we average 4 for the month of March. And then with our total population of out-of-county inmates, with our Morrison County inmates, we average 30. And then just to kind of highlight the last page, out-of-county inmates, we had 6, which brought in revenue from out-of-county inmates at $6,985. I'll get into a little bit of the drug activity, and then I'll open this up for questions, if that'll be okay. But so through the month of March, we've been busy. We had 8 controlled buys, which means we're utilizing informants. We're basically they're advising us they can purchase controlled substances from certain individuals, and they're basically being ran by our investigators. So we had 8 controlled buys, and we had 6 search warrants that were executed. Not all necessarily in Morrison County, although a great percentage was. But again, we belong to the task force who are assisting as well. The guys helped out with conducting surveillance, intelligence gatherings for future operations, reports, drafting numerous search warrants, and following up on tips and assisting other agencies. And part of that assistance has been with their uptick and surge of basically our overdoses involving heroin. I can tell you, a week ago from last Sunday, I was out on one of those calls, and the city of Little Falls actually had 5 overdoses that were called in. So 2 of them simultaneously. So it is a problem. I know I talked to the chief of police, and there was a news release that was put out in regards to that, kind of a public safety, pushing out information, trying to educate the community. But so we're busy. We're busy working these cases and assisting, even though it's Little Falls, they're the primary on these. But our guys, with their experience, with their drug task force background, we're obviously assisting too. So I'll open it up for questions if everybody's got questions on anything.
Mr. Chair,
Zelinski?
if I may, whether or not the tainted heroin, if that's a good term, I don't know if it is or not, whether or not the tainted heroin is in the city of Little Falls, the city of Elmdale, Sobieski, Piers, Motley, doesn't make any difference. That's where you are forced at that point in time to do your concentration of, that's where the event is taking place. So I don't feel slighted one bit that it's in Little Falls or wherever the location is when we have incidents like this. And I think that what it does is it brings to light that, yeah, we live in Little Falls, we live in Morrison County, but the fact is that anything can happen in our community like it can happen in any other community. So for what you guys are doing, Sheriff, I can't commend you enough, because what it is it's work, it's business, it's getting down to ugly stuff. And it's, nobody wants to lose anyone, whether it's through an overdose, whether it's through a car crash, whether it's through alcohol-related stuff, it doesn't make any difference. Where we are today just so happens that we read about it, we hear about it in other locations. It happened here, where we had the, if you will, the tainted heroin, which is a crime all by itself, and I got that, I'm very clear on it all. But we have the tainted stuff here. We've read about this happening in other locations. It's not going to happen here. Fact is that it can, it will, it has. So, thank you.
Anybody have anything else? Commissioner Wincher?
Thank you, Mr. Chair. Sheriff, with these overdoses, is there a age specific, is it teenagers, is it 20 to 30? Is it more common among certain ages, or is it kind of, hey, you don't know, it could be me, could be you, I'm just using that as an example, but.
Yeah, apparently narcotics, it doesn't really care what job you have, how successful you
Right.
are in life, it can impact anyone. But I can just tell you from what we're seeing here locally, with my experience here locally, we're impacting that 20 years old to that 40 on the high end age group. So, and we did have an overdose out in the county, which was kind of like mid-February, or in the February time frame, I guess. I'm not sure the exact date, but, and what we're finding out is a lot of this stuff is, a lot of the players are obviously linked together, and the guys are doing a good job with the investigations. Unfortunately, it's still an active investigation, so I can't sit and get into specifics, but it's just, there's a lot of hours going into this. And there needs to be, because as you can imagine, if you lose a family member, guess whose doorstep they're at? It's ours. And they're looking at me straight in the eyes, they're looking at the chief of police straight in the eyes saying, what are you gonna do about this? When are you gonna make an arrest? And it's not that easy. Of course, we utilize all the resources we can to get the best investigation put together, but sometimes you either need to, they need to be caught in the act, or someone needs to step up and give a statement and/or an admission. Otherwise, we really don't have a decent case. So it takes a lot of hours and leg time in this stuff. And like I said, our guys are doing everything they can. I know all law enforcement involved from different agencies who are assisting are doing everything they can. In the end, hopefully, we get where we need to.
And if I may, Mr. Chair, thanks for that, Sheriff. I have no idea what cost of heroin or whatever. I would assume that's probably why the 20 to 40, because they must have to, like you said, it goes all throughout anybody that's working. So they got to pay for this drug, and, or maybe through theft or whatever. But could you kind of give I don't even know, maybe we can't do that, but what is something like a cost to go get yourself some heroin, or what's the average? Do you have any idea?
I don't have the chart in front of me. I know the state takes an average and they distribute the chart. I know we're in a rural area, so it's not really, your main dealers are gonna be probably the Metro St. Cloud area. So of course, prices are gonna be actually a little bit more higher here, since the availability is not really present. At one time, methamphetamine for 1 gram was over $100. So heroin is more than that. I don't want to be quoted on this, but I could honestly say that it's probably going to be the 120 to 140 and sometimes even more, depending on the availability per gram. So heroin's typically a little bit more than methamphetamine.
Anybody got anything else?
Sheriff, excuse me, Mr. Chair. Sheriff, I just had one other quick question regarding the gas masks. Every sworn deputy has got one? I realize you're not going to share them, so
Yes.
they must have them as part of equipment. I would anticipate that it's everybody on the road.
So to answer your question, Commissioner, you're correct. We had some old gas masks that have been here since I started, which were realistically out of service. So through the use of COVID money, we were able to purchase the mobile field force equipment, which also came with the gas mask. So every officer that has a take-home squad car, which would be our 2 3/4 time positions, as well as full-time deputies, have this gear. Correct.
Okay, very good, thank you.
Commissioner Blaine?
Sheriff, a comment and a question for you. My comment, what is, I guess, is most concerning to me, especially what we've seen lately through the media and reports here locally, not only the number of arrests or people caught trafficking drugs, but the amount of illicit drugs has in some of these recent stops has been impressive, I will say, as far as what we used to read about or hear about stops by law enforcement where we're uncovering maybe 4 to 6 grams of heroin or meth, and now all of a sudden we're seeing stops that are yielding 100 grams, 200 grams of illicit narcotics out there. That's very concerning, and it also, I think, really tells how much trafficking is going on out there of a product out there, and I think it's concerning. But I think the question that I had is, do all of the deputies have access to or carry Narcan in response to these overdose calls?
Yeah, that's a good question, Commissioner. So we do have Narcan. All Morrison County deputies were issued Narcan. We worked with the EMS St. Cloud region, and I believe there's like 8 counties that are part of that region. And because of that, we got free training, and the Narcan is free as well. And I actually did a follow-up call because a couple of our deputies had to use it on, obviously some of the cases were successful, some weren't. But to get the renewal of the overdose, of the Narcan, there's usually a cost associated with it, but we're advised by the EMS director that there would be no cost, which is good for us. So we do carry it, because sometimes with fentanyl, if we inadvertently come in contact with it, which happens a lot, especially if you're going to an overdose scene, if there's any product left over, it's possible, just the illicit drug itself, the fentanyl, can become airborne. And if you even get a whiff of it, it could be deadly. It could knock one of our officers unconscious and or kill them. So we do carry it for that purpose as well as responding to overdoses.
Thank you.
Thank you. Sheriff, I'd just like to, I know in the media, there's been a lot of reports on police officers and so forth, and I just want to thank you guys for all the work you do, and making all these stops usually will lead into something else. So I appreciate the fact that everybody's out there. Thank you very much.
I appreciate that comment. I actually have one more thing if the board has time.
Oh, yeah.
So there's a grant, and we can talk about it. We can talk about if we need to do anything moving forward with it. But Erin Foss was a RN, and she is the opioid program development of outreach coordinator for CHI St. Gabe's. And she wrote this grant, and she actually reached out to me and she asked, hey, would you guys be interested in partnering in this grant that would help with like stationary and portable disposal sites? It's called Deterra. And what it is I don't want to get into the weeds about this, but it's like a bag, and you put your drug take back, your opioids or your pills that are unused or expired into this bag. And what happens is you add a little bit of water, and it deactivates the medication using a carbon solution. So it's environmentally it's friendly. It's not, you don't have to worry about it. You put these pills in, it kind of dissolves itself, and it disposes your day-to-day medications, and it makes the pills inert, so it's not activated anymore. So again, once this happens and that process takes place, there's a capacity of how many pills you can put in these containers and or bags. It'll kill it, so it's inert, and then they're environment friendly. You can throw it in your garbage. So I think it's a way for us as law enforcement to get involved where we can push this to community members as far as at home, our drug take back events that we have, any public events where we have these readily available and we can give this to the community. So I'm going to back up a little bit. She wrote the grant, this Erin Foss. Well, now she no longer works for CHI. She actually works for, she's Assistant Director of Nursing for MEND, which is our correctional care and recovery service. mend is up in our jail. So she wrote this grant. We're informed that we are a recipient, that we were awarded $100,000, which goes towards a lot of these bags and containers that I've been talking about. And again, it's the Datura, and what it is kind of like I explained, but there's some stationary containers too that we could have. So everybody knows how we have our medication disposal unit now. We have one in Motley, we have one in Little Falls, we have one in Morris County Sheriff's Office lobby, and we have one in Pierce. It's not 24/7, it has to be secured, and it has to be under watch at all times. And what this would do is this would allow us to do a little bit of construction where we could have something 24/7. I know the police department, we're gonna work directly with the police department, Little Falls, where they could actually have a container where when you go into their lobby, anybody has access to the lobby. You just can't get through the second door without being buzzed in. Or 24/7, no questions asked, you could actually go into that lobby, take your unused expired meds and get rid of them. And what it is just trying to be more of a resource to the community. I know we've talked to a lot of community members, and a lot of them will tell us that they don't feel comfortable coming into a law enforcement facility to dispose their unused or expired medications. It's something about the sheriff's office, it's something about the police department where they just don't feel right about it. Some of them don't even like coming to the drug take-back programs that we have, but they're a little bit more comfortable there because it's outside that law enforcement setting. So that being said, it's just a way to have 24 access to dispose or get rid of their unused pills. And it's a way where they could actually take some of these bags back to their home if needed. But again, this will be ran by law enforcement. It was kind of turned over to myself to oversee. We're supposed to meet with the project manager coming up, and the project manager is probably gonna let us know, how we need to handle this and what the next steps are. We're just really in the infant stages. I just literally found out about this last week. But I do want to tell you the grant was through the U.S. Department of Justice, Bureau of Justice Assistance. And again, it was a drug disposal grant. So if you need any more questions regarding the Datura drug deactivation system, I'd probably have to read some of the comments here because it's fairly new to me.
Anybody got any questions? If not, I'd like to thank you about that. I think there's a lot of people that have medications around their home. And I think what happens when people break into your home and stuff, that's probably one of the things they go after if you have the right stuff. So it's really good if people can get rid of the stuff they don't need. And I know there's a lot of drugs out there, even legal drugs. The fact, people get these prescriptions and sometimes they're allergic to them and they can't use them. And there it all sits. So I know in Piers that they've been used a lot in the city hall to bring in stuff and things. And so I appreciate that.
Mr. Chair, can I ask a question? Sean, are we getting those dollars here?
So they want Morrison County Sheriff's Office to be the fiscal agent.
Okay, then that would mean you as a board would need to accept that grant so we can act in that role. If you're comfortable, if we want us to get more information and bring it back, we certainly can, but if we are the fiscal host, that's what I need to have you do.
Mr. Chair, are we prepared to do that today?
And that's the question I just learned about it. So if there's more information you need about what that looks like or specifics on the grant use, by all means, we can bring it back. But ultimately, if we're the fiscal host, we just need to have that board action accepting that.
I probably have enough information where I can get through this. I'm just gonna be honest, though, this was something that, again, it was written by a different person and with CHI who no longer works there. And now here we are with it. So, I think to move forward, and like I said, we're meeting with the project manager and this stuff is gonna be fluid now. It might not be a bad idea to have a further discussion here if we need to.
Mr. Chair, was it intended that CHI was going to be the fiscal host, but now not, or were we always intended?
Well, CHI, that position has left, so we are going to meet with the project manager, but yes, we need to have other resources and community, partners, and CHI is someone we're gonna reach out to, correct? But we have to be the fiscal agent, us being law enforcement. That's the way it was written. And that's the way it was intended.
Commissioner Blaine, you look like you have a question.
Well, I was just curious if, Ms. Gruber makes a good point, procedural point as far as what action that we may need to take, but I was just curious if, Sheriff Larson, if the timing is that you would need the board action on this today to continue to proceed, or if we would have, let's say, maybe the 2 weeks between now and when this board would meet again, that if you wanted to provide us with more in-depth information on that. I don't necessarily have burning questions about proceeding with this, but I'm just curious from a timing perspective, if for you to accept this grant or to be able to move forward, you need board action today, then Mr. Chair, that's your call then to make that.
If I can, Mr. Chair. So, yeah, I think I don't see any sense of urgency right now, outside of the fact that we'll meet with the project manager, we'll get some guidance. If we need a breakdown of how the money's gonna flow, that should be fairly easy, because it's all quantities of containers, quantities of pouches, and we're talking, I don't wanna say hundreds, but probably close. And when you start adding up the cost per container, the cost per pouch, the cost per that 24-hour cabinet that needs to get installed, and the construction that goes with it, and all the education materials, that's how we got that 100,000. And myself and the chief of police, Greg Shermers, were heavily involved in that part of it, as far as what are the costs gonna be. So I'd be able to answer that.
I guess that if it's not an urgent matter, why don't you bring it back to us in 2 weeks?
Sure.
And if there's any more details that we need to know, that way we're not voting on something that we just got presented.
Absolutely.
Does that sound okay to everybody?
Yep.
All right. Thank you.
You bet.
Thanks, Sheriff.
Thank you.
Okay, next does anybody need a break or anything?
Why not?
Okay, let's take a 5-minute break.
We could have had our deputy could have came and sat up front here and had front row seat.
Well, I think you're gonna be back, Brady. This is good stuff. I can tell you're gonna be a regular, yeah.
It's good that you are here today.
Thank you for the job you do.
I think he's gonna wanna run for sheriff now.
Well, there's a point you're probably going to want to quit.
Someday. Wait, Mike, I'm gonna be heading out about 20 to 11, because I gotta,
Okay,
no big deal.
we might be done by then.
Oh, I
No,
doubt
probably
that. This
not.
one went over.
Yeah.
Now you got social services, that's a half an hour.
Sometimes yes, sometimes no.
Wonder, with this grant, I always wondered if there's matches, say we had to have a match, but sometimes they'll say, okay, well, we'll spend 100, we'll give you 100, you spend 50.
I have a feeling there's not, but
And then those pouches, what happens when they run out? Then we have to go buy them? See, those are a couple.
I would say the grant money will, when it's gone, it's gone.
And then you don't have pouches anymore, see, that's the.
There's a lot of people out there with prescription drugs, they don't, my wife bought some, one time it was $3,000, she took 2 pills and she couldn't take any more,
And they won't take them back.
No, you can't take them back, you can't do anything, you can't give them to nobody,
Right.
so.
But I say, they should put them in front of a pharmacist like Coburn's or Walgreens, something where I think more people, because again, if they have to go even out front, the police department or
Yeah.
sheriff, they're gonna be, but I don't know, maybe you can't do that, see?
City Hall, they don't seem to be afraid to bring it.
Right,
into.
that's true.
That seems to be one of those spots.
But you'd want to know where the most traffic is, just like I brought it up. The landfill, that wouldn't be a bad one, but to have one of those pill drops, but they said it's just too much chances somebody might break into it,
Oh, yeah, that would be true too.
There's been a number of homes that have been broken into, in talking with the sheriff, where when people came in, there was cash on the table or on the dresser that never got disturbed or anything. There was, other valuables that never got touched, but the only place that was
Is it okay if I get ready, Mr. Chair?
was
Or do you want me to hide back there
was
till we're
medicine
done?
cabinet.
If you don't talk much and you let her talk?
I'll let her talk,
Okay.
yes, I promise.
Unfortunately, we had 2 big overdoses from young
You can
people.
talk.
And the one,
Sounds
Where-
good.
Can you have to shut Melanie because she's cheering too loud, just
2 weeks later, they overdosed. But it's kind of like, don't they tell these people, you know what, your body is no longer being taken. Don't do it. Do they warn them,
I don't think they even know what they're doing,
But if they got
it's kind of like you're hungry and you go in and you grab something to eat.
But rehab, that would be, one guy just got out of rehab. Yeah.
But we don't know what they all go through either.
I suppose Michael.
Most of the time, good work keeps them from that.
Yeah, well, and then like he was saying, $125 for a gram, I don't remember how much a gram is, but Jesus Christ, how can you afford it?
Ain't much.
Huh?
It ain't much. A gram.
That's what I'm saying, yeah. And it's, is that good for
So
one
now
day
that
a
Brad's
week?
gone, we can call it.
One shot?
Yeah.
Do they snort it? They smoke it? Who knows?
Good morning.
Good morning.
Okay, we'll call back to order. Social service report.
Good morning, Mr. Chair, Commissioners.
Hold it. I'm sorry.
Morning, Sarah.
Yeah, we probably got to wait for Deb.
Good morning.
You don't need to wait.
Are we good?
Okay, then you can proceed.
All right, thank you, Mr. Chair,
Hold it,
Commissioners.
Hold it. All right, we'll wait a couple minutes yet. Here she comes. Here she comes.
Look at that, there's, what timing, an entrance.
Start without you, but
I'm sorry.
I have no idea.
I'm sorry.
Isn't that weird?
Okay, Brad, you go ahead.
I got way late.
Social service.
Scene 3,
One time, I got stopped.
Good morning, Mr. Chair, Commissioners. As May is Vulnerable Adult Month, we thought it would be good information to give to the board on our activities around vulnerable adults, and it is a mandatory service that we have to provide to ensure the safety of older folks, disabled folks. And so Sarah is here to present on some of those activities.
Good morning again.
Good morning again.
So first, who is a vulnerable adult? So when we screen these reports for adult protection, our first area of business is to identify if this person is a vulnerable adult. And so there are 2 categories. One is if they're categorical, meaning if they receive services from a licensed provider. They live in a nursing home, an assisted living, an adult foster care setting, or they're receiving some adult day services. Or they receive services from a home care provider, a personal care assistance provider, those sorts of things. So if they meet in that category, they are automatically a vulnerable adult. The next option is if they don't receive any of those services, we look to see if they qualify as a functional vulnerable adult, which they must possess a physical or mental infirmity, meaning they must have a physical, mental, or emotional dysfunction. But on top of that dysfunction, that has to impair their ability to care for themselves: food, clothing, health care, supervision, and based on that infirmity, they cannot protect themselves from maltreatment.
And that's probably the hardest one, you talk about your parents or older folks who are living in the home. So sometimes we end up going out there to make that determination, because it can be hard.
Yes, we can screen in if the maltreatment is clearly existing. If they were a vulnerable adult and that status is a little bit gray, we can screen that in to go in and to determine their status. And so we do that from time to time. So the next slide just shows from 2017 to 2020 our number of reports, how many we've screened in, how many we've screened out. So in 2020, we had 226 reports, like you heard in the proclamation. We screened in 52 with a screened in rate of about 23%. Last year, we had a screened in rate about 27%. In 18 was 20%, and in 17 was 17%. I did compare with the state 2020 screen-in rate, and across the state, their screen-in rate was 21%, so we're at 23%, so I feel pretty good about that. And then as a Region 5, the screen-in rate was about 19%, so we're above that. So in comparison, feeling like we're okay. Next slide. Oh, I should say, sorry, in that first slide, is that we do sometimes get what's called emergency protective services reports. And so those reports have to be screened within 24 hours. That means that that vulnerable adult might be at immediate risk. So we saw 41 of those in 2020, and 17 of them so far in January, February, and March. Ones that are in adult foster care settings, assisted living settings, we would handle the emergency part of that report, but then the rest of that goes to the Minnesota Department of Health to follow up on, or the Department of Human Services. So, but we've seen an influx in those, but to be honest, not many meet that level. 1 or 2 or 3 in a year, to be honest. So. The next slide is our allegation type. So this is what the report might be screened in for. And so in 2020, we screened in 13 self-neglect reports, 7 emotional abuse reports, 5 physical abuse reports, 1 sexual abuse report, 6 financial exploitation reports with a fiduciary relationship, and then 9 financial exploitation reports in non-fiduciary relationship, and 6 caregiver neglect.
So, Mr. Chair,
Yes.
if I may, Sarah, when we talk about, could you explain self-neglect? Very clear on all the other ones that you did here, extremely clear, but what's self-neglect? How would that be? Can you
So if a
explain that?
person meets vulnerable adult status, it means that they are not taking care of their basic needs, which is causing a detriment to themselves. Might not be taking their medications, or might not be eating to the point where they're malnourished, or not taking care of their disability, which is causing them a safety risk, those sorts of things.
Very good.
A lot of times those come from physicians who are worried about their ability to do that, or hoarding is a good example of self-neglect. People like to collect a lot of things and pack their house, and then they couldn't get out.
And then the state, if there's a case manager involved and it's a self-neglect case, we can defer those self-neglect cases to that case manager to try to follow up on and manage through that case management case. That is the requirement from the state, is to try to, work with that service first. But if that case manager goes out there and makes several attempts and there's a safety issue, then adult protection might step in.
Very good. Thank you very much.
Thank you, Mr. Chair. All these things are important. Again, I always use my mother as an example. But when you go into a vulnerable adult situation, this financial one thing keeps popping up at me. Because again, they get my mother, when I go and visit her, she gets so many phone calls, like, from the IRS or whatever, you want to sell you a warranty for, trees or however it is. And when you go in there and visit these, do you kind of explain these are things like, again, if you have somebody self-neglect, that's very common. I know somebody that just spent thousands of dollars on something that was just, it wasn't my mother, thank goodness, but it's just one of those things. So do you try to educate maybe them, the family members, and say, again, and then like my mom's by herself, she, answers pretty much every phone call for whatever reason, so you kind of
Yeah,
expand that?
we've seen an uptick in scams, as you've all know. I mean, I'm sure you're getting calls off the hook too, your insurance warranty and your student loans and all of these things. And unfortunately, with COVID, people are more isolated and more amped to answer these calls and respond to them. So yeah, we have seen a few of those and we screen them in. Those are the most difficult ones because we don't have a perpetrator most often. So we do
Right.
our best, but then we do provide education and, you know, try to get informal supports and those sorts of things. Interestingly enough, for May, for Adult Protection Month, we want to go on the radio and talk about scams and help that population identify what is a scam, how do you respond to a scam, and what does that look like? Because I think for this population, they don't want to be rude to people. That's not in their nature. You know, so hopefully we can get some communication out there.
Thank you. Continue.
So the next slide just talks about, for the cases that we screened in, what was our outcome? So we substantiated maltreatment on 2 of them. We could not make any determination on 1 of them. There were 22 that were false. My number is so small on there. 8 where the investigation was not possible. That might mean the vulnerable adult did not cooperate, or we could not find them, or, you know, some of those circumstances, which I think was a little bit more common during COVID, unfortunately. Not a VA was 11, and we still have 3 pending because we do have a little bit of time to finish these investigations. So, you know, the state has come out and they've been worried about the fact that MARC reports have been down because of COVID. Substantiations have been down because of COVID. You know, you can see our numbers were a little bit down with substantiations. I haven't dug into that yet. I'm not sure if it's because of COVID but that's something I'm looking at right now. But the number isn't drastic, so I'm not concerned about it. The state, adult protection is a little bit behind child protection when you think about those 2 programs, but the state does have a measure that they measure each county on, and one of that is repeat maltreatment in 6 months. So this is the percent of vulnerable adults who experience maltreatment and then do not experience a repeat maltreatment of the same type within 6 months. So that means if we went out and we investigated and we substantiated or found something inconclusive, they're not coming back around in 6 months with a similar allegation. So they are measuring each county on that. I can tell you Morrison County has been at 100% for 2017, 2018, 2019, and 2020. We have not had an issue with this measure. It is in legislature that they want to change that to a year, which would make things a little bit more difficult, I think, so we'll see what that looks like, but that has not went through yet. Starting in 2022, they want to start measuring us on initial disposition within 5 days. So when we receive a report from the reporting center, we have 5 days upon intake, unless it's an emergency report, to make a decision, get the reporter their letter, those sorts of things. So they're going to start measuring to make sure that we are meeting that timeline. Just a few updates. I have a 0.3 FTE for investigators. I do have an intake worker that, not full-time, but she works on, you know, monitoring the reports that I receive, coordinating screenings, those sorts of things. Starting January 1 of 2022, MARC will no longer notify law enforcement of after-hours EPS reports. So we're gonna have to come up with a plan for that. So currently what happens is the Minnesota Adult Abuse Reporting Center will notify law enforcement after hours if there is a report that they feel like is an emergency. So January 1st, that is going away. So some discussions on what that should look like, not sure yet. It's very infrequent that those come in after hours, but we still need to come up with a plan. So Brad and I have been talking about that. And then we do have some new state allocations for adult protective services. We had received some money in July of 19, about 5,000, and then in July of 2020, about 10,000 or 11,000. And so really, that's been going towards the adult protection staffing and those sorts of things. Then the state is looking at some COVID relief funds specific to adult protection. So they had sent out a director survey, and these are sort of the results of what the director said of what kind of things that could be useful with those COVID funds. Minnesota's looking at about $1.5 million. And so how much Morrison gets or what that looks like, we do not know yet. It's supposed to be dispersed in April and spent by the end of September of '22. So more to come on that as well. And then I thought it would be helpful to talk about, you know, the last year has been COVID, and obviously we spent a lot of time working with this population outside of adult protection. So, you know, who are those sectors of the community that we worked with? Long-term care facilities, foster cares, board and lodges, shelters and treatment centers, vulnerable people living independently, and the homeless. And one of our objectives through our department operations centers teams was to identify that gap population. You know, who were we missing? Who wasn't responding to the messages that we were giving? And so we really worked hard on outreach to that population. So I just added a little slide on things that we've done through public health and through that team. Weekly calls with the long-term care facilities, weekly adult foster care communication, coordination calls, meaning, you know, talking to providers, hospitals, clinics, you know, providers all across the community, trying to connect people and connect resources, delivery and coordination of masks, gowns, gloves, and other protective personal equipment. Lately, the biggest thing we've done is vaccine outreach, working with long-term care facilities, connect with pharmacy partners, coordinating with the hospital and the clinic. We did some senior housing outreach with Horizon Health so that we could get that over 65 population that was kind of in that gap group, and worked with them on getting transportation to one of our vaccine clinics, and that was really, really fun. And then connecting with, you know, public health and social services staff on their clients who are vulnerable, and making sure that they, you know, were making them appointments and we were getting them in. And so also a lot of resource connection, messaging through the radio, the newspaper, the Facebook. We did the produce delivery, as you all know. And then Carmen and I actually wrote for a UCare grant, which we were granted in about December of $50,000, and we're coordinating with Horizon Health, TriCap, Little Falls, and Pierce Food Shelves, and we are delivering food shelf food to community members 60 plus who are transportation dependent. And so that really got rolling kind of mid-March. And so I think Little Falls has made about 50 deliveries so far, and Pierce about 15 deliveries. Hopefully we can get that moving a little bit, but that's been exciting. And then we did our One Vegetable, One Community project, where we sent those seed packets and resources in every Morrison County record, copy of every Morrison County record. So that was very busy. So any questions or?
Does anybody have any questions? Commissioner Blaine?
Thank you, Mr. Chair. Just wanted to go back, Sarah and Brad, earlier in your presentation, Sarah, you'd said, and correct me if I'm wrong, but I interpreted this, that you would take certain investigations to a certain level, and then in some cases, these would be turned over to the state of Minnesota, to Department of Human Services or whatever. Yep. So the question I have is, can you comment to us on how our county views that response by the state of Minnesota in these cases? Are you know, are we comfortable with, let's say, the response time, the effectiveness of the state of Minnesota when they're called in to investigate these allegations? Are we getting the results that the people of Morrison County should respect, or?
Yeah, I haven't seen any concerns with that. You know, what we do is we screen for the emergency part of the report and make sure that their immediate safety is met. and then we communicate back to either DHS or MDH and let them know, we've either responded or it doesn't meet this, and then they let us know, okay, that we'll be screening it, and then they'll tell us if they're going out. And so, they're very responsive and communicative as far as I can tell with our reports.
And so in any of these instances where we have to have a case referred to the state of Minnesota, we're getting communication back that from them that they've closed that investigation and the results of that? Would that be fair to say?
On occasion, we get, if we get their emergency report, yes, they'll communicate back with us. Sometimes we'll get some reports if it's an adult foster care, because we might have to follow up for licensing. But yes, I would say the communication is back and forth quite often with them.
We also will get notified if there are licensing violations, because we'll have a record of that, because sometimes we may have to monitor that. But, yeah, overall, they're pretty good. Generally, if nothing has happened, we don't hear. But if there's licensing violations or they gave it to us for an EPS, they will let us know. So it's much better than it used to be. I think you're talking about some prior history.
Yeah.
I think the responses have been much better. The communication has improved significantly prior to, a couple of years ago. So
And
I think they're better staffed.
And I try hard, and our staff tries hard to communicate to it. I'm not sure if that's a requirement that we have to tell them what we're doing necessarily if we screen it out, but we do. We tell them, and if we screen it in and what we find, of course, we tell them. But, we make sure we communicate every step that we're doing so they can pick it up from there. So that works well, and then they communicate back to us.
Okay, very good. Thank you.
Does anybody got any other questions? If not, we thank you, sir.
Thank you,
Thank
Sarah.
you.
Thank you very much.
I have a public health report.
Yes.
If the board would please approve the following establishment licenses: a new mobile food unit for Crock and Roll, a new establishment owner for Little Falls Dairy Queen, a renewal for Fish Trap Lake for a seasonal, a new owner or an owner for Silo Ice Cream, and another renewal or a summer one for Chaminade, and the College of Wilderness Knowledge.
So move, Mr. Chair.
Got a motion by Commissioner Lemire, seconded by
Second.
Commissioner Wincher. Any further discussions? Not all in favor signify by saying aye.
Aye.
Thank you.
Opposed, motion carries.
The next thing on the agenda, and Melanie is here because she wrote the grant, did a very good job, and I didn't know how detail-oriented the questions might be. And so it is that time of year again for Sourcewell Innovation Funding, although now they call it Community Impact Grants. And Region 5, the counties of Cass, Morrison, Todd, Wadena, and Crow Wing are applying for another community grant. So we all can work on creating a collaborative with, I have to find the exact title, community, or CIBS is what I call it, or what we call it. Collaborative Intensive Bridging Services, which is an intensive training for our provider community on working with kids with mental health issues. And they create a system of care that includes foster care, providers, staff, families. And it's really a way to divert kids from placement, longer-term placements, and work with kids and their families in their home. Crow Wing County has a grant for this particular project, and now we're trying to expand it to the 5 counties. We're asking of Sourcewell to fund this at $269,000. It's very costly to train all of these professionals in this particular process. And so we are submitting this grant with the collaboration of, again, the 5 counties in Region 5. And it has to be submitted May 5th, and then the grant review will be June 7th, 8th, 9th, somewhere in there. I can't remember the exact date in June. So we are doing this. I think it's a great collaboration between the 5 counties. It also will hopefully become an evidence-based program, which could become 4A funded when we use it in about 2 years under Families First. So we'd like to move this grant forward. We'd be the fiscal host.
Mr. Chair, I'm going to move on that.
Second.
Okay, I got a motion by Commissioner Jelinski, seconded by Commissioner Lemire. Any further discussion? Not all in favor, signify by saying aye.
Aye.
Opposed? Motion carries.
Oh, you could ask Melanie one question. But she did a great job. I mean, writing this, it was quite a long application, and she did a great job, so,
Thank you, Melanie.
Thank you, Melanie. Thank you, Brad.
thank you. Have a good day.
Yep. Is extension online
Samantha's here.
or, I'm sorry. Extension report. Welcome, Samantha.
Hi, everybody.
Good morning.
Good morning. All right, I don't have a lot to update. You guys heard from me last month. So I wrapped up my Go Wild nutrition education with the third grade classrooms in Morrison County. I completed 7 courses, so 4 at Lindbergh, 3 at Lincoln. I got a lot of great feedback from the teachers. I think with COVID and all the stuff they had to handle, having those recorded lessons with just short little video clips recorded by me and kind of integrated in them, they seem to work really well at the third grade classrooms. So a lot of great feedback on that. We'll see if they want me back in person next year or more recording or maybe some sort of hybrid model next year. We'll look at that in August though. Every Kid, I'm also working with the schools to do Every Kid Healthy Week. That kicks off on Monday of next week. So that is actually a national program. So kind of just focusing on overall health and wellness with youth. So examples like we came up with a bunch of activities and resources for the teachers to use in their classrooms, outside, however the teachers saw that they could best fit into their day, and stuck it with the themes for each day of the week. So Mondays, like Mindful Monday, so we're like, oh, here's a 2-minute yoga video to start off your day in like your kindergarten classroom or whatever classroom, or 5 minutes of, thoughtful reflection or something. Tuesday was Tasty Tuesday with COVID restrictions. There wasn't a lot we could expand on that, but we thought, water-infused water or fruit-infused water in the classroom, which gave some of the teachers some ideas of things they could do, even talking about recycling in the classroom, some other just maybe discussions, because with COVID restrictions, there's not a ton we could do. We used to do taste tests in the past, but we weren't quite able to do that as well as this year. Wednesday is Wellness Wednesday. Can't remember, some of the examples came up with that, but we came up with examples for every day of the week for elementary, middle school, high school. Came up with some things we could send home to the parents. They can try to do at home as a family, even putting things on like the TV monitors that are in the commons. There's Thoughtful Thursday and Fitness Friday. So we tailoring activities to each of those themes for next week, kind of an overall health and wellness week for all the schools. So that was a resource I helped put together for the schools. Dr. Knight received some funding, can't remember, it was pre-COVID, sometime before COVID hit, to do an outdoor classroom with their space. And they were able to purchase the seating last year, right before COVID hit, but they weren't able to implement it. Now we're hoping to do some activities this year, especially with kids needing mask breaks and wanting to do stuff outside. So we're coming up with activities that are centered around, getting outside, maybe incorporating it with trying to do a math lesson or a science lesson outside, and then coming up with those activities and sharing them out with Dr. Knight and see how well that works to kind of start using that outdoor space that they set up and we're hoping to use last year. And I will continue to work with the schools. I was working with the schools from the beginning of the school year, doing flyer-friendly weekly wellness tips and the monthly calendar. Those were sent home during COVID, but now that they're back in school in person, it's kind of like a take-home resource for them to do at home. I'm also working closely with the farmers market in Little Falls. They are going to apply, they're currently applying for an EBT machine. They applied and were approved to accept SNAP for the state. And so they put in the application, I think, talked to the market manager last week, about a week ago, for the EBT machine for at least through the state that will be fully funded by the state. And that's just going to increase the use of the farmers market to the entire population. And then with that, we're hoping, COVID pending, that we can offer some education, maybe some market tours and some other ways to promote the market, maybe some other educational opportunities that I can provide in partnership with the market to promote the EBT machine, as well as the POP Club they signed up for this summer. The POP Club is kind of, that's a token thing for the youth. Every week the kids show up, so your kid can come every week, receive a $2 token, and they can buy whatever fruit or vegetable they want at the market. It's gotta be a produce item. And the way program is set up, it was piloted in Oregon in like 2011. It's got a ton of great feedback, and now they're kind of pushing it nationwide. And so kids can shop for whatever produce they want. It's to encourage healthy eating with youth and ideally families, because it's targeted towards kids ages 4 to 12. So to get to the market, ideally their parents come with and their parents also shop. And then again, hopefully we can do some education and maybe some fun like games or activities like a scavenger hunt. I have a list of ideas I'm hoping to do at the market this summer. We'll see how many of those I can actually, set up and do. So those are two things that are gonna be happening in the market. I know the market is also doing music and markets on the Mississippi, so we're hoping to tie in with that this summer and really kind of push and promote that healthy eating in the farmers market in Little Falls. What else? Oh, Oasis Share a Meal. I know during COVID for a while they had to shut down. They used to do community meals. I can't remember what day of the week it was. But now we're reaching out and partnering to do to-go meals. So now we're currently working on the logistics of that, what kind of foods can we prep ahead with little food handling, least amount of people, touching food, and they're easy to go, and then not knowing what people have at home to reheat or cook these meals, try to keep them as simple as possible too. So they're hoping to get that all figured out, including updated on their standards with food safety handling and all that, by new COVID guidelines and state standards, having that all done and ready by July. So I'm helping them with that right now. I think the first meal is July 15th is when they hope to get started. So I think that's most of my big updates.
Sounds good. Does anybody have any questions? No, I really like you working with the farmer's market with the
I'm
machines
actually
and
really
stuff.
excited about that
Yeah.
one. I've been reaching out kind of subtly for the past couple of years and kind of just waiting, because I know the market manager does a lot already, and she's really busy. I don't know how many you know Birdie Peterson. She does a phenomenal job, so.
Sounds good. We thank you very much.
Yeah, thank
Good.
you.
Thank you, Sam.
Okay, auditors report.
Get your shirt.
See you later, Randy.
Yep.
Good morning.
Good morning.
Morning. I have a new member with me this morning that's not on the agenda, so I just wanted to introduce our newest member, our land record specialist, Laura Donahue. She's been in our office for a week now and fitting in very, very well, so.
Excellent.
Welcome.
Thank you.
Yes, welcome
Thank
to
you.
the county.
I told her we threw her breakfast this morning just to be new, for our employee appreciation
And
event.
Chelsea got me pizza on my first day too, so.
Just can't beat it.
Yeah,
pizza's
you get
my
quite the
favorite.
Welsh.
It's like you
Don't-
wanted me here, so.
Yes, that's a good addition.
Yeah, excellent.
Great, welcome.
So, Mr. Chair, this is another husband-wife team as county employees, is that correct?
Sure, if
It
you're
is.
okay with us talking
Yeah,
about that,
it
yes,
is,
yes.
I am, I think that's, I think it's, I think it's awesome.
I do too. We are a family, I think, and I think it says a lot when families are willing to invest in Morrison County. We certainly appreciate that, so.
We both, speaking for him as well, feel pretty lucky to be able to work so close to home.
Good deal, welcome.
Super.
Yep, thank you and welcome.
Thank you.
On the auditor's report, I have our March cash report, so this is a monthly report that you see. And it has all of our funds broken out by fund type or in their individual buckets. So just by statutory, we bring this forward monthly. And then last but not least, I have a request to pay the bills.
Can I get a motion on that to pay the bills?
Someone, Mr. Chair.
Got a motion by Commissioner Lemire, seconded by Commissioner Blaine. Is there any further discussion? Not all in favor? Oh, I'm sorry, roll call. Commissioner Lemire,
Aye.
Commissioner Jelinski.
Aye.
Commissioner Blaine.
Aye.
And Commissioner Wilson, aye. Motion carries.
Thank you.
Thank you very much.
Excellent.
Thank you. Commissioner Lemire, you're okay down there?
Yeah, it's a trap down here.
Oh, no.
Randy leaves and you can't even
Yeah,
hardly
right away.
respond.
We don't often have injuries during the meeting, but it looks as if we may need to report that.
Public Works. Welcome, Steve.
Good morning, Steve.
Good morning, Steve.
Mr. Chair, it looks like Steve has this extra glow. I think it's because perhaps you're grandpa again.
Oh.
That is one of the
Is
cutest
that-
babies ever.
Well, congratulations.
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 Yeah, lucky.
When it rains, it pours. I got another one coming in July, so.
Awesome.
Awesome.
Good
Great.
deal.
Mr. Chairman, members of the board, I have a number of items for your consideration. Our first two requests for board actions go together. You're seeking proposals from contractors for the replacement of two structures, one being with Two Rivers Township on 100th Avenue, which is a bridge replacement that we'll be removing and replacing with large box culverts, 2 lines. And then the other one that the board is very familiar with, that we've been working on for some time, is the replacement of the structure over the Little Elk, just to the north of, in Randall. It's one that we have worked with the DNR to accommodate the Camp Ripley Veterans Day Trail on also. And so the two items that we would be considering, the first being the proposals that we received from the 4 contractors and a resolution recommending award to the lowest responsible bidder, being Marvin Treader Incorporated. But at the same time, I'd like to address request for board action number 2, because what that does then is enters into an agreement to help fund the replacement of the structure. So we have, under this contract, we have a number of funding sources. The township bridge replacement will come from the town bridge account. Those are funds that we receive an amount every year. It goes into our account. When we have a structure that qualifies, then we move forward with a contract like this to replace it. We bid these together because, it works best in managing this contractor with our staff and the amount of work that we have going on. So that the town bridge funds are just funds that we manage, just like our county state aid regular construction or municipal construction account. We previously entered into an agreement with the Department of Natural Resources for $200,000 that are their contribution towards the cost of carrying the Camp Ripley Veterans State Trail with this structure. And then that amount was $150,000. The other $50,000 is going towards engineering, construction, staking, inspection that our staff will do as that part of that project. So with what's left on the County State Highway 1 bridge replacement, the agreement gives us about $209,000 in state bonding money, local bridge replacement bonding money, that will go to cover approximately half of the cost of the replacement of our share of the replacement project, and then the remainder comes from our regular construction account. So the request for the board today would be that you've reviewed our abstract, that you would adopt the resolution that would award this contract to Marvin Treader Incorporated, if you're satisfied with the proposals.
I'll make a motion to approve, Mr. Chair.
I have a motion by Commissioner Lemire, seconded by Commissioner Blaine. This is a roll call. Commissioner Jelinski.
Aye.
Commissioner Blaine.
Aye.
And I, Commissioner Lemire.
Aye.
Motion carries.
Thank you, Mr. Chairman. Mr. Chairman, members of the board, then the second action is to enter into the agreement and adopt the resolution for the bonding funds.
So move, Mr. Chair.
Got it. Motion by Commissioner Lemire, seconded by Commissioner Blaine. Roll call, Commissioner Blaine.
Aye.
And I, Commissioner Lemire.
Aye.
And Commissioner Jelinski.
Aye.
Motion carries.
Mr. Chairman, members of the board, request for board action number 3 is one we discussed last board meeting where we were reviewing and awarded to CNL Construction the Piers project and Safe Routes to School project. Following the county board's award, that was conveyed to MnDOT, which then drafted the agreement that is a part of your packet, in which the Safe Routes to School is the city of Piers obtained 2 funding sources to pay for the trail. They received federal funds in the Transportation Alternative Program, which we've already addressed, but they matched that by obtaining bonding money through the Safe Routes to School program. That's what this agreement is for. It's to provide the match for the trail, the match for the TAP funds for the trail for the City of Piers project. So our request is that the board would adopt the resolution and approve the agreement, and the chairman and the administrator to enter into these agreements for that bonding money.
Mr. Chair, I'll move on that.
Okay, we got a motion by Commissioner Jelinski,
Second.
seconded by Commissioner Lemire. Any further discussion? If not, this is roll call. Commissioner Blaine?
Aye.
Commissioner Wilson, aye. Commissioner
Aye.
Lemire, aye. And Commissioner Jelinski.
Aye.
Motion carries.
Thank you, Mr. Chairman. Mr. Chairman, members of the board, then my last request is that we have received notice that one of our long-term and excellent employees is going to retire. One of our best motor blade operators, and probably I'd say in the state of Minnesota, has decided to call it quits. And we are requesting authorization to proceed with filling that position.
So moved, Mr. Chair.
Got a motion by Commissioner Blaine, seconded by Commissioner Jelinski. Any further discussions? Not all in favor signify by saying aye.
Aye.
Opposed? Motion carries.
Thank you,
Thank
that's
you,
all I
Steve.
have.
Thank
Appreciate
you
it.
very much.
Thank you, Steve.
Thank you.
Okay, administrators report.
Mr. Chair, the only action item I have is to set a budget committee meeting. I don't have a particular date in mind, I just know that April 27th next week doesn't work.
For what was this?
A budget committee?
Can we have that after a board meeting or after a planning?
We can, just not next week, if you wouldn't mind avoiding that, I'd appreciate it.
Today is the 20th.
We certainly could do the 4th of May or the 11th of May following a planning.
I would say the 11th.
Works with me.
The 11th of May?
Yeah.
All right, we'll probably,
Out there, if it's okay with you, Jeffrey.
No, it's fine with me.
After that day, we have a planning session, correct?
yes. So I typically set it maybe for like 10:30, so I can get other people's calendars set, and hopefully we're not too far off. How's that? If we
Okay.
find the agenda is super long for some reason, I might modify that if you don't mind, but otherwise we'll shoot for that.
Okay, May 11th, 10:30?
10:30 is what I'll likely set it for.
Budgets.
Yep,
Okay, very good.
Send us an invite or?
yes, that'll get set up. Steve will do that.
Steve?
Anything else?
Better do it.
I don't have anything else for you guys unless there's anything that I'm missing that you need from me.
Okay, I guess next we have our committee reports and upcoming schedule. What dates are we looking for?
April 25th through May 8th.
Commissioner Blaine, would you be able to start us off?
I can do that. On Monday, April 26th at 5:30 PM is Extension Committee meeting. On Tuesday, the 27th, that morning of our planning meeting, I will have to exit that planning meeting at 10 o'clock, and I'm going to say thank you to Tabitha for her help in helping me find a place where I can go to here quickly. I have a Personnel and Budget Committee meeting with Region 5 as an exec board member of Region 5 Development Commission. So I'll have to step out of our Planning Commission meeting and attend that online from 10 o'clock a.m. till noon. That evening at 6 p.m., we have a Board of Adjustment Planning Commission meeting.
Thank you.
The following week, on Tuesday, we have a board meeting at 9 o'clock, and on Friday, the 7th, I have we have TSWAC at 8:30?
Yes.
Or is it, or will that be was that TSWAC or is it
TSWAC.
Public Works?
Yeah.
It's a landfill meeting, and I did talk to Steve about that, and we're hoping to hold it out at the landfill again. But I will let you guys know for sure if you're comfortable with that, or if you have any objection. We were kind of hoping to get back out there.
And Mr. Chair, that's all I can contribute.
Okay, I don't think I have anything to add. Tabitha, my calendar's kind of screwy here. Do I have anything else besides what we mentioned here?
On the 6th, you have a council on aging.
Okay, that would be right.
But otherwise, I think you're good.
Okay, thank you. Commissioner Lemire? Thank
The
you.
only thing is, did Greg get the Planning Commission Board of Adjustment meeting on the 27th?
Yes.
Okay, then that's it.
Do you have HRA on the 6th?
Nope, I had it yesterday. I goofed up last month.
Is there something, I have Planning Commission on Monday, the 26th, and I got Board of Adjustment on Tuesday.
That's probably in reference to the old schedule prior to.
Right.
And I shouldn't say that, but I mean.
No,
in my-
I
in
think
my
you're
mind,
right.
I think that if you had scheduled ahead, or whatever that might be,
So is it on Tuesday?
it is on
Yes,
one-
okay.
it is on
Sounds good.
Tuesdays.
Thank you for
I'll
that.
see if we can't clean those up, and delete those if they're populated by someone other than you yourself. I don't know if Sharon sent those out for the whole year or not.
I don't think so.
I thought she avoided doing that because we kind of anticipated a change coming, but maybe we.
She sent the new ones out but it does say Planning Commission Board of Adjustment on it, so
Okay,
it does
okay.
separate the two by that.
Sounds good,
But it's the correct day.
yeah.
Okay,
Tuesday.
all right, perfect.
Okay, Commissioner Jelinski.
On the 26th at 9 o'clock in the morning, I've got an Emergency Communication Network Regional Leadership meeting that's going to be virtual. On the 30th at 10 o'clock in the morning, I've got a Central Minnesota Emergency Services Board or Joint Powers Board meeting. To the best of my knowledge, that will be virtual. On the 3rd of May, Commissioner Blaine and I have a Good Neighbors EMS meeting at CHI St. Gabe's at 6 o'clock in the evening.
So what got changed to the hospital?
It's at the, that's what the invitation says, from what's her name. But I don't have any idea what that means, other than it's at CHI St. Gabe's, period. Information I have doesn't say anything more than that.
It's not a very big building.
No, not at all, not a bit. That's the information I have,
That's Monday, May 3rd.
May 3rd,
At what time?
at 6 p.m.
And the name of it was?
It's called Good Neighbors EMS.
That's something we're all supposed to be going to, or?
No.
Oh, okay.
And then on the 5th, and I'm not positive that this is still on, but I'm supposed to, at 11 o'clock, have a Central Minnesota Emergency Services Board Executive Committee, and I have in parentheses here a Civic Summit. I'm not sure that this is actually happening yet, for sure. On the 6th, at 10 o'clock in the morning, I've got a State Emergency Communications Board Legislative Committee meeting. That is by phone and or virtual. And Mr. Chair, to the best of my knowledge, that's all I have.
Thank you very much. If we have nothing else, can I get a motion to adjourn?
So moved.
Got a motion by Commissioner Jelinski, seconded by Commissioner Lemire. All in favor signify by saying aye.
Aye.
Opposed? Motion carries. Meeting's adjourned.